Hello, thank you for watching the video. This time I'll talk about ways to reduce the risk of prostate cancer, what symptoms may appear for early detection, and the prostate cancer screenings currently done in health checkups. I'll also explain the hidden aspects of this, so please listen until the end. Prostate cancer is the most common cancer in men. It gradually increases with age, starting to rise around the age of 50, and by the time you reach 80, it's said that 1 in 2 men will have prostate cancer. However, compared to other cancers, prostate cancer has a higher survival rate and a lower mortality rate, and is considered a cancer with a relatively high chance of survival. For cancer, there's something called the 5-year survival rate, which is the percentage of people still alive 5 years after diagnosis. For prostate cancer, if it's at an early stage, if it's stage 1 to 3, the 5-year survival rate is actually 100%. In stage 4, when cancer has spread to distant parts of the body, it often spreads to places like the lungs or bones. And when that happens, the percentage of people who survive after 5 years drops to 60%, meaning that 40% of people may pass away, so it's something to be careful about. You might not be very familiar with the prostate, but it's located just below the bladder, which stores urine. It produces a fluid called prostatic fluid, which is part of semen and helps protect sperm during ejaculation. The prostate also has the role of controlling the flow of urine by contracting. So what kind of people are more likely to get prostate cancer? Let me give you the answer first. Westernized diets, obesity, having a family member with prostate cancer, and surprisingly, the number of times you ejaculate are all related. In addition, men who had high levels of male hormones and were energetic when they were young, but whose male hormone levels decreased as they got older. People who have lifestyle-related diseases such as obesity, high blood pressure, diabetes, or high cholesterol, and surprisingly, those who are highly educated and have high incomes. Lastly, people who are not sociable and prefer solitude. It is said that these types of people are at higher risk of having an enlarged prostate. This is quite interesting data. So what should we do to lower the risk of prostate cancer? Let's look at the 3 factors that increase the risk. First, the number of ejaculations, which many of you may be curious about, has been found to be related to the risk of prostate cancer according to research from Harvard University. According to that study, men who ejaculated 21 times a month or more were found to have a 20% lower risk of prostate cancer. In other words, this data suggests that the number of ejaculations after the age of 40 may be related to the risk of prostate cancer. That means you need to ejaculate 21 times a month or more, or 5 times a week or more. Being able to do that after turning 40 requires quite a bit of stamina, so I would recommend engaging in risk-reducing activities as much as possible within your own limits. However, this is just one study, so it hasn't been completely proven. However, if the flow of pancreatic juice in the pancreas is blocked, it can increase the risk of pancreatic cancer, and if the flow of stool is blocked, it can increase the risk of colon cancer. In other words, I think it's credible that if prostatic fluid builds up because you don't ejaculate, the risk of prostate cancer increases. The second risk factor is a Western-style diet. Actually, the number of prostate cancer cases in Japan has been increasing year by year. Aging is one factor, but a Western-style diet has also been cited. I explained in a previous video that eating too much red meat increases the risk of colon cancer, and there is something called saturated fatty acids that are found in large amounts in meat. It is believed that these saturated fatty acids can worsen prostate cancer before it becomes large, and that an increase in male hormones can also raise the risk of prostate cancer. Eating meat makes you feel more energetic. That's the kind of image people have, right? I think it's easier to understand if you consider that this is related to male hormones. That means there is a treatment for prostate cancer called hormone therapy. It's well known that Japan's Emperor Emeritus also developed prostate cancer, underwent surgery, and unfortunately had a recurrence, but then received hormone therapy afterward. So, as diets become more westernized, limiting saturated fat intake may help reduce the risk of prostate cancer. And the third risk factor is obesity. A study conducted on Japanese people showed that those who were obese were more likely to be diagnosed with advanced prostate cancer compared to those who were not obese. What this means is that obesity can cause inflammation to occur in the prostate. It has been suggested that when inflammation occurs and puts stress on the prostate, it may worsen prostate cancer. The good news for those people is that there are ways to lose weight that may also lower the risk of prostate cancer. That is exercise. It is said that when people exercise, their male hormone levels temporarily decrease. This hasn't been completely proven either, but exercise is known to help with high blood pressure, diabetes, and cholesterol. It's needless to say that exercise is good for all of these, so please try to lose weight, and also do exercises that lower male hormones to reduce the risk of prostate cancer. Wouldn't it be good to think about it that way? The fourth risk factor for prostate cancer is having a family member with prostate cancer. If you have 2 or more family members with prostate cancer, it's said that your risk is 4.4 times higher. If your father has prostate cancer, your risk is 2.4 times higher. If your brother has prostate cancer, data shows your risk is 3.1 times higher. However, as I mentioned at the beginning, after the age of 80, 1 in 2 men will develop prostate cancer. With that in mind, you might think it's not very helpful, but what's important is the age at which it develops. If a family member developed prostate cancer before the age of 65, your risk of developing prostate cancer increases. If a family member developed prostate cancer at age 65 or older, your risk is 1.9 times higher, but if it was before 65, your risk increases to 2.9 times. So if you have any of the initial symptoms of prostate cancer that I will talk about next, and if you also have a family member with prostate cancer, please be sure to consider visiting your local hospital or a urology clinic. Let's review what we've covered so far. One of the factors that increases the risk of prostate cancer is having a low frequency of ejaculation, and also adopting a westernized diet, obesity, and finally having a family member with prostate cancer. These were the factors I explained. Now, let's move on to what initial symptoms may appear when cancer develops in the prostate. I'll explain this in 3 parts. The first symptom of prostate cancer is urinary problems. You may notice your urine stream is weak, or that only a small amount comes out. You might feel unable to fully empty your bladder. These symptoms make sense when you consider the anatomy. The prostate is located along the urinary tract just below the bladder, so if cancer develops there and presses on the urethra, it can make it difficult to urinate or prevent you from emptying your bladder completely. These kinds of symptoms can appear. And actually, the prostate contracts during ejaculation to narrow the urethra and prevent semen from flowing backward into the bladder. When cancer develops, it also loses the ability to regulate this function. Normally, when you urinate, I think urine comes out within about 3 seconds. If you have prostate cancer and it causes an obstruction, it can take nearly 10 seconds for urine to start coming out. Such symptoms can also occur. The second symptom of prostate cancer is frequent urination. When you have prostate cancer, you may need to go to the bathroom more often. Our bodies feel the urge to urinate when the bladder reaches a certain pressure. When it's prostate cancer or a condition called benign prostatic hyperplasia, the prostate becomes enlarged. When the prostate presses against the bladder, it stimulates the bladder and the brain gets confused, thinking, isn't the bladder full? As a result, you feel the urge to urinate more often, leading to frequent urination. This is called bladder irritation symptoms. But please think about it carefully. If cancer develops on the lower side of the prostate here, it doesn't seem like it would easily press against the bladder, does it? That's right. If cancer develops in the part close to the bladder gets pressed and you experience frequent urination. But if cancer develops in the prostate in a place far from the bladder, symptoms may appear later. The third symptom of prostate cancer is a feeling that your bladder hasn't fully emptied or urinary leakage. Men, have any of you ever felt that it's hard to urinate after ejaculation? As I mentioned earlier, when you ejaculate, the prostate contracts to prevent semen from flowing back into the bladder. So even if you try to urinate right after that, it takes time for the prostate to relax, making it harder to urinate. If cancer develops in the prostate, which is responsible for such regulation, its function will be lost. The prostate may open even when you don't need to urinate, causing urine leakage. Or the prostate may contract unnecessarily, making it feel like you can't fully urinate or that you have residual urine. These kinds of symptoms can also appear. How does that sound? The symptoms make more sense when you consider the anatomy and function. Be cautious, as all the symptoms I mentioned can also appear with benign prostatic hyperplasia. These issues may occur simply from an enlarged prostate, so if you notice any of them, you should go to the hospital and get additional tests like an ultrasound, blood tests, and urine tests to determine whether it's benign prostatic hyperplasia or prostate cancer, or if it might be another disease, so that a proper diagnosis can be made. Let's review. The initial symptom of prostate cancer is urinary problems. I explained symptoms such as a weak urine stream, only dribbling urine, or feeling like you haven't fully emptied your bladder. The second symptom is frequent urination. When you develop prostate cancer, the bladder gets compressed and you need to go to the bathroom more often. The third symptom is urinary leakage or incomplete emptying. When the function to narrow or widen the urethra is lost, it can cause urine leakage, or conversely make it difficult to urinate, resulting in a feeling of incomplete emptying. Now finally, I will explain what kinds of tests are recommended for people who have the risk factors mentioned at the beginning or have symptoms. Did you know that prostate cancer can actually be examined by touch? If you thought, wait, you can feel prostate cancer by touch, that's exactly right. In fact, to check whether the prostate is enlarged or if cancer has formed and made it hard, this is exactly where the examination is done. There's an examination where a finger is inserted through the anus and rectum to feel the prostate. This is called a digital rectal exam. It's the least expensive and simplest test you can have. For patients, it can be embarrassing or uncomfortable, so if a patient really doesn't want to do it, explain that it's not absolutely necessary. By using your hand, you can check the prostate's normal softness and the firmness from an enlarged prostate compared to the firmness from prostate cancer. There is a way to tell the difference. Everyone, please touch your thumb and little finger together. At that time, feel the softness of the palm on the little finger side. This is the normal softness of the prostate. I think it's quite soft. And then, try touching the ball of your thumb, the base of your thumb. It's a bit firm, isn't it? It's firm, but I think it still has some elasticity. This is the firmness when the prostate is enlarged. And finally, try touching the bony part at the base of your thumb here. This is obviously bone, so it's hard and rough. When you feel this kind of hardness, it could be a sign of prostate cancer. However, with a rectal exam, it's often not possible to detect small cancers. So the rectal exam is mainly used to check for obvious prostate cancer. In such cases, there's a simple, widely available blood test. That's the PSA test. In fact, many hospitals offer this as part of a health checkup for prostate cancer screening. You might be wondering, what is PSA? What kind of test is it? It's simple. PSA stands for prostate-specific antigen, and I know that might still be a bit unclear, but to put it simply without worrying about being misunderstood, it's a blood test that checks for substances that leak into your blood when the prostate is damaged. That's the kind of test it is. So to mention it ahead of time, the downside of this test is that PSA levels can go up not only with prostate cancer, but also with benign prostatic enlargement. And PSA levels can also increase as you get older, or if bacteria infect the prostate. Normally, if your blood test shows a PSA level of 4 or below, it's considered normal. If it's 10 or above, it's considered abnormal, and a more detailed examination is needed. So what about levels between 4 and 10? In that case, depending on your age and risk factors, we might do more detailed tests, or we might wait some time and measure it again later. Then, we'll check if the level has increased to see if it looks like prostate cancer. However, should we do prostate cancer screening for all men? On that point, even in the medical community, opinions are divided and there is disagreement. First, regarding the opinion of the leading authority, the U.S. Preventive Services Task Force. Basically, please do not perform this PSA test on all men who have no symptoms. They have issued a statement like that. Then why are hospitals still doing prostate cancer screenings? You think so, right? So what is Japan's position on this? Even in Japan, opinions are divided. Here's the point. Actually, prostate cancer screening is considered a voluntary screening. It's similar to a comprehensive medical checkup that individuals pay for themselves and undergo voluntarily. On the other hand, there are organized screenings such as breast cancer screening, cervical cancer screening, and colon cancer screening. These kinds of screenings are the ones where the local government provides subsidies and encourages everyone to participate. So what does that mean? The more you do organized screenings, the more benefits there are. In other words, by doing these screenings, you can detect diseases early and even reduce the mortality rate. Screenings that have solid data supporting these benefits are considered organized cancer screenings. The fact that Japan has made prostate cancer screening optional means that there is no confirmed solid benefit even if you undergo the screening. It's not an exaggeration to say that's what they're saying. Simply put, from the perspective of local governments, since they're not sure if there's any benefit, they let people who want to do it freely. They won't provide subsidies, that's the general idea. The Japanese Urological Association is fiercely opposed to that view, almost as if they're vehemently rejecting it. In the United States, isn't it possible that the number of people with metastatic prostate cancer has increased because they stopped PSA screening? And isn't it possible that the benefits described in the paper supporting that claim are being underestimated? That's what they're arguing. As of 2018, the Japanese Urological Association recommends that people over 40 should have their PSA levels checked during health checkups, even if they don't have any symptoms. And for those over 50, as a national cancer screening measure, all men are encouraged to be screened early for prostate cancer. They suggest that it's better to have your PSA levels checked. That's what they recommend. It's getting a bit complicated. In conclusion, the truth is that even in the medical community, there's no consensus. What's important is to fully understand the advantages and disadvantages, and then decide what to do together with your primary doctor. The benefit of PSA screening is measuring PSA levels, identifying high values, doing more tests, and if prostate cancer is found, treating it to reduce mortality. That's correct, right? So what are the disadvantages? As I mentioned at the beginning, if prostate cancer is up to stage 3, the 5-year survival rate is 100%. So if cancer is found early through screening and due to advanced age, you're told the cancer is small, so we'll just monitor it for now. How do you feel about that? Additional testing costs money, and even though you've been told you have cancer, is it really okay to just leave it alone? Wouldn't that kind of anxiety arise? How about you? Isn't there a big difference in happiness between living your life knowing you have cancer in your body and living without knowing it? According to a study by Harvard University in the United States, the number of suicides and heart attacks was twice as high among people who were diagnosed with prostate cancer compared to those who were not. There is data like that as well. I think this shows just how shocking it is to be diagnosed. And there is one more disadvantage. As a test to determine whether it is cancer or not, there is a procedure called needle biopsy. Let me explain what this test is. An ultrasound probe is inserted through the rectum to locate the prostate. A needle is inserted through the skin between the anus and the scrotum to collect actual prostate tissue, which is then examined under a microscope to check for cancer cells. An ultrasound probe is inserted through the rectum, and a needle is placed in the skin here. It sounds tough, but the test is almost painless and usually takes only about 15 minutes. It's actually scary when you have to go through it, isn't it? In many cases, the test is scheduled as an overnight stay. And there's another disadvantage to the test. Bacteria can enter from here, causing an infection and sometimes a fever. Also, the urethra can get injured, causing blood to mix with the urine, which is called hematuria. It can also make it harder to urinate. There is a possibility of such complications occurring. In this way, testing for PSA can lead to the discovery of prostate cancer that doesn't actually need treatment. This is called overdiagnosis. There are disadvantages such as overdiagnosis, and there are also complications from the test itself. Those are some of the drawbacks. Well, even so, isn't it good that even if you find cancer that doesn't need intervention, you can have regular checkups with your doctor and get treatment when it's actually necessary? Some people feel that way, and I believe that's true. The advantages and disadvantages I just mentioned, as well as your age and risk factors, and your view on health. How do you want to live your life? It's important to discuss these things with your primary doctor and make a decision together. The PSA test can have a major impact on the rest of a person's life. At this point, it's not clear whether it's definitely a good idea to take it if you have no symptoms. If doctors don't strongly recommend the test, you might skip it. If living with an unnecessary cancer diagnosis seems difficult, it may be fine not to take the test. Well, that might be true, but since I have a family history and I'm at risk, I think I'll go ahead and take the test. Also, just the idea of not taking the screening when it's available makes me anxious, so I think I'll get tested after all. It's good to have different options. Like with any test, there are pros and cons. It might be more important to find a doctor who will listen to your thoughts and help you consider everything together. Why do we even have health checkups in the first place? Is it just to find abnormal values? That's not it, right? It's to stay healthy, right? It's also important for your mind to be healthy, so please take some time to think about what health means to you. Since this has gotten a bit long, let me summarize. The PSA test is basically recommended for people who have symptoms of prostate cancer. However, whether it should be done for people without symptoms is a topic of debate worldwide. The benefits include early cancer detection and a potential reduction in mortality. The drawbacks include overdiagnosis, meaning people may be diagnosed even when treatment isn't necessary, and the additional costs for further tests. Complications can also arise from procedures like needle biopsies. I mentioned that these things can happen. Because of these kinds of drawbacks, I explained that it's important to consider both the advantages and disadvantages, and to discuss what you want to do before making a decision. I believe that many people watching this video are highly health conscious, and that there are also many who actually have benign prostatic hyperplasia or prostate cancer. On YouTube, a variety of people, both medical professionals and non-medical people, are sharing medical information. Most of it is very informative, but some of it can be misleading. So that you don't end up regretting believing incorrect information, I will clearly explain things from a doctor's perspective using data and including anatomy and physiology. I think it's important to have at least one reliable channel, so if you'd like, please subscribe so you don't miss any new videos. It would really encourage me. And in the comments section, please let me know your thoughts about this test, any symptoms you've experienced, or how your treatment went. If you have any such information, I'd love to hear from you. And if you could rate this video with either a thumbs up or a thumbs down, it would motivate me for the next one. Well then, I'll see you in the next video.